Okay, so the question is asking, based on the 2200 nursing notes, complete the sentence below to fill in the blanks. And we see that the client had the PCI done. We already know she had that MI done. But now at 2200, she's feeling restless and just generally unwell. She has some bruising, the catheter sites look good, and then we're seeing these vital signs here. So here are the things that stand out to me. Well, that blood pressure or the heart rate is high. So we know that the client had an MI. We know they had a PCI done. Now, a complication of an MI is potential shock. What type of shock can this client go into? Well, they can go into cardiogenic shock. So this is the complication that is happening right now. For those of you who are kind of confused, keep in mind the timing. It's asking us about what's going on right now. How do I know they're having shock? Well, I see that heart rate is elevated. We know we see tachycardia generally when our clients are experiencing cardiogenic shock, right? And then we see that she's restless. Whenever you see restlessness on the NCLEX, think about maybe we have delayed tissue perfusion to the brain. That's happening in shock. So that is an assessment finding that would be alarming for me. Somebody might ask, hey, what about that blood pressure? It is 100/67. That blood pressure is okay. It's actually improved from previous. So that's not telling me that she is in shock. It's on the lower side of, it's on like the borderline low side, but the MAP, the mean arterial pressure would probably be sufficient here. I really only get excited when that blood pressure drops below 95 systolic. Okay. So these are two assessment findings that we are seeing. Does it matter the order? Great question. So typically when you get these questions on the next gen NCLEX, there will be a drop down that you can click from. So click whatever one is pertinent in that drop down. I don't think it matters which order it goes into. Okay, great. So that is the correct answer for that question. We are seeing the client in shock now because of that heart rate and the restlessness. Awesome, awesome job, everybody. Okay. Yeah, we definitely would be keeping a close eye on that blood pressure. You got it. All right, guys, just wanted to do a little bit of information on this private tutoring that we have available here at Archer Review. So some of you may are taking the NCLEX for the first time. Maybe this is your second, third, or fourth time taking the NCLEX. And especially if you're one of those latter students, really take advantage of the private tutoring sessions that we have available at Archer Review. These are a really great resource for you to ask any questions you have, literally any topic that you need review on. If you want us to review your readiness assessments, we got you. If you want us to create you a study guide, we got you. If you just need someone to cheer you on, that is what we are best at. So feel free to scan that QR code if you're interested in booking private tutoring. They are $75 for an hour. Okay. Next question here. So now we're working with a 10-year-old diagnosed with gastroenteritis. So we see that the client's parents indicated he's been vomiting for the past 12 hours and he's been unable to keep any fluid or foods down. The client's parents report a similar illness has circulated in school for the last several weeks. The assessment shows a child who's lethargic and fully oriented. Skin is hot and the eyes appear to be sunken in appearance. Capillary refill time was greater than 2 seconds. The client was communicative and reported no pain. Bowel sounds were active in all 4 quadrants, with no pain endorsed upon palpation. The client has no known medical history, is up to date with all immunizations, and does not take any medications. All right, let's see where this question is taking us. We see a temperature here of 38, a heart rate of 101. Respirate is 14, blood pressure 100 on 70, and 97% on room air. Okay. One thing that I do recommend for you when you are doing these next-gen NCLEX questions is to really focus on the stuff that's going wrong with the client. So we know that the client here, for example, has been vomiting. They're unable to keep any fluids or food down. The client is lethargic. Skin is hot, eyes are sunken. Capillary refill time is greater than 2. So that's part of the steps to clinical judgment. First of all, we're recognizing clues or cues that are standing out to us and then analyzing them. For example, this capillary refill time that is greater than 2 or it's delayed is telling me that the perfusion is probably not so good. So when in these next-gen NCLEX questions where it's giving you a lot of information, it can feel overwhelming. Take it one by one, point out the things that are standing out to you. And yeah, Abby, analyze the cues. This is telling me that maybe the client is dehydrated, the perfusion time is off, and we are definitely seeing a high temperature. Okay, now that we have an idea of what this client is looking like and presenting with, let's move on to the question. So, based on the client's assessment, the nurse should plan to take which actions? Select all that apply. A, measure the abdominal girth. B, instruct the avoidance of sweetened drinks. C, insert an NG tube. D, start 24-hour urine collection. E, provide a mask to the parents. Or F, obtain an order to insert a PIV. Which actions should we be taking? Let me know in the chat here. Remember, we had a nice idea of what the client was looking like. They looked dehydrated, signs of low perfusion, those sunken eyes. Very good. I'm seeing some awesome answers here. The nurse should plan to take which action? Select all that apply. So let's take a look. First of all, whenever I get a question like this on the NCLEX, I always try to read each question at least twice. The first time I get an idea of what the question is asking me. The second time I'll point out the important parts of the question and clarify the question to myself. So in this question stem, I'm seeing that the nurse should plan to take which actions. This is really important because this is telling me I'm looking for correct actions to take based on my assessment. So I'm looking for the trues if I were to treat each option here as true or false questions, which we love to do here at Archer. Every option is select all that apply question is almost like an individual true or false. So based on this client, do I want to measure his girth, his abdominal girth? Not really. False. I don't want to take that action. Okay. Do I want to instruct the avoidance of sweetened drinks? What do you think? Yeah, I do want to do that, right? B is also right. You got it, Yasmani. First of all, we put this client NPO, so he really should not be taking anything by mouth. And second of all, those sweet drinks really can exacerbate dehydration. It would actually make you feel a lot worse. So when you're feeling thirsty, drink water. Don't drink a sugary cola. Do we need to insert an NG tube? Well, this client has gastroenteritis, right? We don't necessarily need an NG tube right now, right? Client can stay NPO. We can do some other things. We don't need an NG tube. NG tube is more so for clients who have maybe bowel obstructions or need bowel or can't swallow, for example. D, start 24-hour urine collection. Not necessarily. This client's not having any evidence of renal disease, right? We don't need to do a 24-hour urine collection. E, provide a mask to the parents. We don't really need to do that right now. It's not necessarily something I need to plan to do. And then F, should we insert a PIV? Oh, definitely. Well, we said that this client was looking dehydrated. We do want to insert a PIV. Wonderful. So let's take a look. B and F are correct, right? We don't want the client drinking anything sweet. We want the client to have this PIV. Great job. So how are these select all that apply questions scored? Remember when select all that apply questions are really, they can be quite scary. And it's because there's just so much information, it is overwhelming. The nice thing about the next gen NCLEX, now we're getting partial marks for select all that apply. So For example, if we have two correct answers here, the biggest amount of points that you can get is 2, right? If you chose one correct answer out of the 2, then you get 1 out of 2. If you get both of them, then it's 2 out of 2. Now, what happens is if you click something or you choose an option that is incorrect. Let's say you wanted to insert an NG tube, and this is one of those options you selected. You chose B, C, and F. Well, here now you chose 2 correct answers. You chose 1 incorrect answer, and every incorrect answer is a -1 score. So if you chose B, C, and F, you would get a total of 1 out of 2. So we are getting partial marks, but remember that you are getting -1 for every incorrect answer. Okay. Great job, everybody. Let's move on. How old was the client? They were 10 years old. All right, so this is a different question, different client. Select the most likely option for the missing information in the table below by choosing from the list of options. Each option may only be used once. So imagine as if this was a drop-down list, okay? So blood product here. We have, this table here that's telling us blood product, infusion time, and nursing intervention. So we need to match the blood product to the infusion time or nursing interventions, or vice versa, depending on which row we're looking at. So let's tackle this first row here. We see an infusion time of 2 to 4 hours, and we see the intervention of give the product with 0.9% saline and Y-type tubing. What type of blood product is this describing? PRBCs, FFPs, or platelets? What do we think? Good, yeah. This is going to be describing PRBCs. You got it. PRBCs. So PRBCs are infused over 2 to 4 hours, and we do prime the line with normal saline and Y tubing. Okay, next one here. Fresh frozen plasma. So we know the blood product now. Now we have to determine the infusion time. Is it infused over 15 to 30 minutes, over 2 to 4 hours, or 60 to 75 minutes? Yeah. So FFPs are given fast, I think. F for fresh frozen plasma, I think F for fast. So we are going to administer it over 15 to 30 minutes. Wonderful. And then afterwards, we will assess the PT-INR after transfusion. Great. Lastly, platelets here. Do we want to, we do want to infuse platelets fast as well. Platelets go fast. And now for nursing interventions, will we reassess the hemoglobin after transfusion? Will we make sure the product is ABO compatible, or will we give it through short tubing and a small filter? What do we think? Which nursing intervention will we select? Remember, this is the one that's applicable to platelets. Nice, Vanessa. You guys got it on the nose. Nice, Ruby. Christine. Great. So we do want to give through short tubing and a small filter. Yeah, it needs to go through a filter. Okay. We don't necessarily need to assess hemoglobin after the platelets. We would probably assess hemoglobin after PRBCs. We would maybe reassess platelets after infusing platelets. Okay. And the funny thing about platelets that they don't actually need to be ABO compatible. Platelets are come in a pool. Sometimes you might see them ordered as one pool of platelets, and that's actually a pool of up to 10 donors. They don't care which ABO type they are, as long as there's platelets in there. That's what we want to be getting. Great job, everybody. So these are the things that we're seeing with our blood products. Somebody had a good question about the previous question we did, the select all that apply, and they were like, is it better for us to choose less options for next gen NCLEX? And I would say, yeah, if you're guessing, especially if you're guessing, or if you're doing a select all that apply question, Only choose the ones that you are for sure about, okay? Don't try to willy-nilly choose in extra ones because remember, every incorrect answer works against you. You'll get -1 points. Okay. Next one here. The nurse is caring for a 75-year-old client who arrives to the ED. Now, at 1900, we're seeing that the client is arriving with a left facial droop, inability to move her left arm and leg, and expressive aphasia. According to the husband, they were out eating dinner. The symptoms started suddenly and she fell to the ground. The symptoms started 45 minutes prior to arrival at the ED. Past medical history includes atrial fibrillation, hypertension, diabetes, and hyperlipidemia. We see temperature of 37, heart rate of 86, rest rate of 18, blood pressure 181 over 109, and then the sats are 95% on room air. Okay, take a minute, think about what you think is going on. Remember, you're going to pick up on those cues, recognize the cues, analyze them, and generate your hypothesis on what you think is going on. Kind of cling to the things that are abnormal here, like that blood pressure is really high. Okay, now let's move on to our question. Oh, we have a bow tie question here. This is one of my favorite types of questions. So here we're going to complete the diagram by dragging the choices below to specify which condition the client is most likely experiencing. We're going to pick 2 actions that we should take to address the condition, and then 2 parameters that we're going to monitor to assess the client's progress. Okay. So these are really fun questions, I think. They're so good at testing your knowledge. So when you're tackling these bow tie questions, I always like to start in the middle here, the potential condition. And you guys have already been starting to generate hypotheses on what you think is going on. Which condition do you think is occurring? Bell's, a partial seizure, complex migraine, hypoglycemia, or CVA? Yeah, you guys got it. For sure. I think this client is having a CVA as well, right? Cerebral vascular accident. Wow. How do I know that's happening? Well, remember, she had sudden onset unilateral weakness. She had facial droops. Those are all telltale symptoms of a stroke or a CVA. Good. Now, on the left, let's pick some actions to take. What are 2 things we want to do? Do we want to transport the client for a CT scan? Will we obtain a manual blood pressure, prepare for lumbar puncture, obtain labs, or prepare for an MRI? Pick 2. Yeah. So you guys are saying CT. Definitely. We do need to get the client to the CT scan because if she is having a stroke, we need to determine what type of stroke she's presenting with, right? Because we know the ischemic and hemorrhagic extremely differently. Now, what's the other thing that I want to do? I do want to obtain labs, right? Especially checking that glucose level. Because when a client is experiencing a stroke, or stroke symptoms, it's possible that they could be experiencing hypoglycemia. Some symptoms that we see in hypoglycemia mimic a stroke, so we do have to check their blood sugar. Okay, now we're going to go to the right of the bow tie. Let's figure out what parameters we want to monitor. So do we want to monitor the GCS? Do we monitor gait, vital signs, blood pressure, orthostatics, or visual acuity? Nice. So we do want to check the GCS, of course, especially if they think they're having a stroke. We need to monitor their neurostatus. Are they getting worse or not? I would definitely be doing a GCS pretty frequently, at least every 15 minutes in the initial period. And then I do want to check the vital signs. Again, we're checking that pretty frequently in the initial period to see if there's any change. Wonderful. You guys have completed the bow tie. Great job. So let's see what this looks like. It is so satisfying, isn't it, to see the bow tie like this? And you're just like, I did this. I was able to figure out what condition it was. What am I going to do about it? And what am I going to monitor? You guys are going to be awesome, awesome nurses. Very good. It is a cool feeling, isn't it? Next one here. Oh, let me just tell you about small group tutoring. for a hot second here. So small group tutoring is similar to private tutoring where you have an interactive session with one of our awesome tutors here at Archer Review. But in small group tutoring, you have a session that has up to 20 other students in the session. And we cover a very specific topic. So we have small groups on anything that's hard on the NCLEX, like prioritization, on pharmacology. We have mock NCLEXs if you like this like practice NCLEX style. We have a 2-hour NCLEX review. There are tons and tons of small groups that we are offering. And the nice thing about them being small groups is that you have it's a bit more affordable. It's $25 for the hour rather than $75 per hour. And there's tons of tutors for you to choose from. If you bundle 3 sessions, then you can get a bit of a discount. It's a 10% discount. So feel free to check out our small groups if you are struggling with anything specific. All right, let's get back to the questions here. So 6th question here. Small groups available every day. Yeah, we have small groups around every single day. Sometimes the weekends are a little bit more difficult, but we do offer weekend sessions here and there. Okay, so now we're working with a client in an outpatient surgical center who's scheduled for a cholecystectomy. So that means, tell me what a cholecystectomy is. What does that mean to you? We never really had a course on what all of these procedures are, right? Cholecystectomy, that prefix chole tells me it's the gallbladder. Good. And then that suffix ectomy tells me we're removing it. So this is surgical removal of the gallbladder. Amazing, Amy. Amazing, Karen. Great job. Okay, so our client here is getting his gallbladder removed. And it's 7:30 a.m. He's arriving to the pre-op area with his family. He's anxious about the procedure, understandably. Getting body parts removed is a scary thing. The pre-op assessment was completed at this time. We got a 20-gauge PIV in the right AC. We got blood return and it flushes without resistance. So we're checking it's working and it's working fine. The client reports no pain at the insertion site. All right, so we're reviewing the pre-op assessment. I want you to highlight the findings on the assessment which require follow-up. So we have the demographics. We got the ID verified and the band is applied. That should say applied. Legal, the surgeon has not obtained formal consent or informed consent. Medications, the client took his prescribed phenytoin with a sip of water this morning. Diet, the client reports his last meal fluid intake was the previous day at 2200. And then discharge planning, the client stated he was going to drive himself home after the procedure. So let me help you out. I'll number these. 2, 3, 4, 5. Tell me which of the assessment findings require follow-up. If you see this require follow-up, that tells me we're looking for the incorrect items. Take a minute. Let me know what you think. All right. I'll show you the answer. So you guys are right. So 2 and 5 are the ones here that require follow-up or are incorrect. Now, why? Of course, if we're getting the gallbladder removed, we should be obtaining informed consent. Of course, we need written, signed consent, making sure the client understands all the risks and the benefits to the procedure. And you're right, Karen, we cannot have this client drive. Anytime a client is going under general anesthetic, like they would for a surgery like this, they are not going to be driving, okay? So they should definitely be arranging transport home. It's okay for them to take some medications in the morning, especially if it's a medication for seizure, like phenytoin. The client has been NPO, so that's good. And we have his ID band on and verified. Wonderful. Why 3? It is okay for the client to take some medications the morning up, especially if it's an important medication like phenytoin. Remember, if the client doesn't take that medication, they're at risk for seizure. So it's pretty high risk. We will allow them to take that medication. All right, next question here. So we are caring for a 44-year-old male now who is experiencing abdominal pain and persistent nausea and vomiting. Now, the abdominal pain has started 1 day ago following heavy alcohol use. The pain is localized to the epigastric region. Persistent nausea and vomiting were reported. The physical exam showed ecchymosis around the umbilicus and tenderness upon palpation. The temperature here is 99, heart rate 119, respiration's 22. The blood pressure is 90 on 58, and the sats are 95% on room air. And when we check his labs, here you go. You can see a number of laboratory findings here. Tell me, what are some things that are standing out to you? What are some things that are standing out to you in this question? Thankfully, on the next-gen NCLEX, you do get normal lab findings given to you. Okay, so you have normal lab findings, which is great. So I see the sodium is a bit low. Yeah, you're right. The white cell count is elevated. The blood pressure, somebody said, yeah, it's on the lower side. I definitely will be concerned about that. That heart rate is high, and there's some bruising around the umbilicus. Okay, let's see what's going on here. We got another bow tie question here. So remember, when we're tackling this bow tie question, we got to go to the middle first. So tell me, which potential condition do you think this client is experiencing? They have this persistent abdominal pain for the last day. They're having this nausea and vomiting, and you picked out those symptoms that were standing out to you. What do you think this client has? Nice. Awesome, everybody. Really great. You guys are saying, hey, this client probably has acute pancreatitis. You got it. How do you know that? Well, they're having this abdominal pain, and it sounds like they have a history of alcohol use disorder, right? So they might be drinking lots of alcohol, and that can, of course, cause pancreatitis. The bruising as well definitely is a sign, and the white count was elevated, also signs of pancreatitis. Good. Now let's go to the left here. What are some actions that we want to take? Tell me, do we want to get a saline bolus? Do we want to inquire about the alcohol habits? Do we want to get a prescription for insulin? Should we get a PIV? Or should we take the client for a CT scan? What do we think? Take a minute and decide. Seeing some really awesome answers here. So remember, we do want to prioritize things here, right? So I do remember his blood pressure was low. I do want to get him to have a saline bolus going. That might help with his blood pressure. And how are we going to give those IV fluids? Of course, we need to get an IV, right? So those are the two things that I do want to prioritize. Of course, maybe later on after we have stabilized this client, we'll talk about alcohol, but these are the two things that I do want to prioritize. Now, what are some things we're going to monitor for? What will we monitor? Level of consciousness and the vital signs. Exactly. We need to monitor the vital signs, see if that blood pressure is getting better, monitor the level of consciousness to see if there are any acute changes that will occur. Very, very good, everybody. Satisfying. Look at that beautiful bow tie. You guys did that. Wonderful. Do they give you lipase levels? Good question. I don't believe they had lipase levels here. If the client did have a lipase level drawn, what do you think it would show? This client here. Would his lipase level be normal? What do we think? No. Meenakshi says no. The lipase would be high. Yeah, Vanitha, it would be increased. Exactly. So if somebody has pancreatitis, typically they would be experiencing high lipase levels. Good. Remember, NCLEX will give you normal ranges. You just have to be able to identify that lipase is high, probably related to pancreatitis. Okay, wonderful. Here is another next-gen NCLEX question. So now we're dealing with a 19-year-old male who's presenting with right elbow pain and swelling, and it's been going on for the last 3 days. The client says he scraped his elbow while rollerblading, and it's become painful and swollen for the last 2 days. He reports waking up with a fever of 39 and feeling lightheaded. On assessment, the client is lethargic and pale. The client has a full range of motion in the elbow, but is reporting pain with movement. The client reports pain of 7 on a scale of 0 to 10. The elbow has erythema, so there's some redness there with a large red bump. It's swollen and it's hot to touch. When we see the vital signs, we have a temp of 38.5, a heart rate of 111, respiratory rate is 22, and the stats are 94% on room air. Okay, let's take a look and see what's going on here. So there's some things I see that you guys are putting in the chat, things that you're thinking about is happening. Remember, paying attention to the abnormal findings and then prioritizing or making hypotheses on what's going on. Okay, so we are going to specify if the potential prescription is anticipated or contraindicated in this client. So do we want to obtain peripheral vascular access? Yeah, we do. Some people are saying, hey, maybe he has an infection. Exactly. And maybe he'll need some special medications, right? So we will want to anticipate some IV access being started. And this is one of the things that we do as nurses. We anticipate. We see things happening before it even happens. So, that will come with time, but your intuition is going to get really good once you start nursing. You will be able to anticipate things happening. Okay, what about administering albuterol via nebulizer? Is that anticipated or contraindicated? What do you think? No. People are saying no. No, we don't really need albuterol at this time, right? This client's not having an asthma attack, so we don't need to give that. Good. What about the next one? Collect blood cultures. Should we be doing that? Yes, we do want to be collecting blood cultures. What are some things you might want to keep in mind when you take blood cultures? What are some nursing considerations that we should take when taking blood cultures? Of course, we're going to do it when the client has a fever. Yep, you got to consider their temperature. And ideally, we're going to be taking those blood cultures before we give any sort of antibiotics. Ideally. Exactly. Great, Amanda. Next, do we want to infuse hypertonic saline at 30 mils per kilo? No, hypertonic saline at this time? I don't think so. The client's not experiencing a head injury. We don't really need hypertonic saline right now. Good. Administer broad spectrum antibiotics. What do we think? Yes, we definitely want that. The client had a fever, right? They're having redness and swelling to the site. It's hot. For sure, we should worry about an infection, get antibiotics on board. Yes, ideally after the blood cultures have been taken. Good. Lastly, do we want to collect a serum lactic acid? What do we think? Is that indicated or not? Yes, you're right. It is indicated. People are like, I think, I'm not sure. It is indicated, but why? Why are we interested in this lactic acid? What does this tell us? What do you think it tells us? So white blood cell count is the best lab for infection, but this lactic acid will tell us about shock. And more specifically, we are worried about septic shock. You got it. We're worried about sepsis here. And if septic shock is brewing in the client, then that lactic acid will be elevated. Okay, so that's why we want to be taking that. Great job. So we have 1, 2, 3, 4, 5, 6 here, 6 rows. Then the total answers here would be out of 6. This one's pretty clear on scoring. Great job. Okay, we got another one here. This one's a big one. Okay, so we got a 66-year-old client near her. It's male, arriving to the ED following a recommendation by his primary healthcare provider. The client called his healthcare provider in the morning. He said he had a headache, he was feeling unwell, he's fatigued and thirsty. He could not check his blood glucose because he was out of testing supplies for the last 2 weeks. He also reports being unable to take his prescribed antihypertensives and anti-diabetic medications for 1 week because he lost his job. On exam, the client reports feeling fatigued and thirsty. He is alert and completely oriented. His physical exam was within normal limits, except for thready pulse with a rate of 119. The client has a medical history of type 2 diabetes, congestive heart failure, hypertension, and hyperlipidemia. He's prescribed atorvastatin, metformin, and lisinopril. When we see his vitals, we have a temperature of 37.5, heart rate of 119, respirations of 22, blood pressure is 92 on 58, and the sats are 91% on room air. Whoa, guys, there's a lot going on here. What are some things that are standing out here to you? What are some things that are standing out? Take a look at his labs. Take a look at his symptoms. Get a bit of an idea of what's going on. Low blood pressure. Temperature is not quite fever yet, but I would be definitely monitoring it here. But we see blood pressure is low, the heart rate is high, the sats are low. These are all telling me that there's something going on here. And if you look at his symptoms, well, he has a headache, he's feeling fatigued, he's thirsty, he has a very significant history. And then you see his glucose is super high, his sodium is incredibly low, which makes sense that the healthcare provider has ordered seizure precautions. The potassium is low, so the healthcare provider has ordered potassium. We're checking the blood glucose. The client has healthcare providers ordered normal saline, 2 liters over an hour, insulin, IV access. Got a bunch of things going on here. So you guys are thinking that maybe the client is in DKA. Now, one of the things about DKA, that usually happens in type 1 diabetes. This client has type 2 diabetes. So if that's the case, what is his most likely diagnosis? HHNS, exactly. HHNS is most likely what's going on here, right? Especially if you're seeing his ketones here, they're negative. So there's no serum or urine ketones, so it's not DKA. In DKA, ketones would be elevated, and that would happen in type 1. Here in type 2, we're having that super duper high blood sugar and symptoms of dehydration that is indicating HHNS. Now, what those two disorders have in common is dehydration. Severe dehydration occurs in both of those disorders. So the healthcare provider has put in some orders. Which order should the nurse clarify with the healthcare provider? A, infuse 2 liters of normal saline over 1 hour. B, obtain a glucose every 2 hours. C, potassium 20 milliequivalents by mouth. Or D, implement seizure precautions. I'm going to make it a bit easier for you and flip over to this slide so you can just kind of see everything at once and tell me which of these orders here are questionable. Take a minute. Let me know what you think. So, oh, sorry, this one. Let me just show you. These were the ones, oops, these were the ones that were options here from A, B, C, D. Yep, I can show you the question. The question was just asking which order should the nurse clarify with the healthcare provider. So which of these orders, A, B, C, D, should we clarify with the healthcare provider? Ah, some of us are pointing at some good stuff here. Hmm. Okay, I'll show you guys. So the correct answer here, this is pretty tricky because there's a lot of stuff going on here. The correct answer here is A. Infuse 2 liters of normal saline over 1 hour. Okay, this is the one that requires follow-up or needs clarification because it is concerning to me. Why is this concerning? Why is this concerning? Take a look at his history. Is there something in his history here that might tell you that's not indicated? Ah, yeah. There are a number of reasons here why we don't want the 2 liters of normal saline going over 1 hour. So that is really fast. You get 2 liters of saline over 1 hour. That is super fast. And especially for somebody who has congestive heart failure, that's going to be a significant amount of fluid. Remember, in congestive heart failure, the heart is really weak, really tired, and really sensitive with any increased workload. These clients are already at risk for fluid volume overload. So we don't want to overload that client even further. Okay, so congestive heart failure, we should be very, very gentle with IV fluids. We should not be infusing them very fast. And again, somebody also noted their sodium level. It was 129. If you gave all that fluid really fast, it's possible that sodium level will go down even further. So that's just another reason why we don't want to infuse too fast. Yeah, really. So this is a type of question where we had, 4 options. We need to select the one that is correct, and we were able to. Okay, I think we have time for one more. Let's do one more here. So we're caring for a client here with acute asthma exacerbation. The 48-year-old here has arrived to the emergency department from work where she was exposed to aerosolized chemicals and became extremely short of breath. The client arrived in moderate distress with tachypnea and audible wheezes. The client has a medical history of asthma, hypertension, and an MI 2 years ago. And at 17:05, 2.5 milligrams of albuterol was administered via nebulizer. And during the treatment, the client reported a sudden onset of chest pain. Now the client is pale and diaphoretic, so the nebulizer treatment was discontinued and oxygen was reapplied. So the nurse understands the chest pain was caused by the albuterol. Sorry, the chest pain was caused by the albuterol because this medication, A, increased myocardial oxygen demand, B, lowered heart rate, or C, caused parasympathetic stimulation. It was appropriate. Actually, sorry, yes, answer this one first. A, B, C. What do you think? The chest pain was caused by the albuterol because this medication does what? Yeah, so A, it increases myocardial oxygen demand. The thing that albuterol does is it stimulates the sympathetic nervous system, causing your heart rate and blood pressure to go up, causing your bronchioles to dilate, and that actually can increase myocardial oxygen demand, so increases workload on the heart. Okay, last part of this question. It was appropriate for the nurse to discontinue the nebulizer, and the nurse should immediately obtain a prescription for what? IV propranolol, a 12-lead ECG, or a chest radiograph. You got this. I know you do. Amazing. Yes, we do want to get a 12-lead ECG. So B here is correct. 12-lead ECG. Remember, anybody experiencing chest pain, we definitely want a 12-lead ECG done. Great job, everybody. So in this question, this is a bit of a funny one because there are 2 options here, but you actually will only get a score of 1 here because these questions are about relationships. We need to be able to create relationships. You want to link one with the other one, so you will get a score of 1 if you get both of these correct. All right, everybody. That is all we got today for our free webinar. Hopefully you found all of these next-gen NCLEX questions a really great exercise for your critical thinking and a great way for you to practice your steps to clinical judgment. I think there are an awesome change that the NCSBN has made, and hopefully you have a bit more clarity now. If you need anything else from us, you can always email us at nclextutors@archerreview.com, or feel free to book a private or small group session with us. We would love to see you guys.